Congratulations on your new XDR sensor. It's important to understand the proper way to care for your digital sensor because in the clinical environment there are fundamental differences in the way one handles a digital sensor versus film. But with proper care, your sensor can provide quality radiographs for several years. So here are some precautions we recommend. When taking the sensor out of its case, never pull on the cable to take the sensor out. Always hold the USB connector and gently unwind the cable until the entire cable is out of the case. Then firmly hold the sensor plate and take the sensor plate out of the sensor plate housing. Be sure to read the cards that are in the case because they contain important information regarding your sensor. Always hold the sensor by the USB connector when plugging or unplugging the sensor into a USB port on a computer or powered hub. Remember to watch out for static discharge while handling your sensor. Static electricity strong enough to shock people is a danger to your sensor. Avoid shock to the sensor, such as dropping the sensor on hard surfaces. Although your sensor is made to be reasonably sturdy, letting the sensor hit hard surfaces can shorten its life. When handling the sensor, always avoid kinking or twisting the cable. Always let the cable lay in its natural state. Sensor holders are great tools. Not only do they help with position and alignment of the sensor in respect to the teeth, jaws, and X-ray unit, they also help protect your sensor. So using a sensor holder is always a great idea. Be aware of what side of the cable you're on before you put it in someone's mouth. Believe me, having the sensor cable out of your walkway can protect your sensor, make things a lot easier for you, and possibly save you some embarrassment. When the sensor plate is in a holder, avoid holding the sensor where the cable and the sensor plate meet. Holding the sensor in that area repeatedly can put unnecessary stress on the cable and sensor plate connection. Instead, hold the actual holder. It's safer for your sensor and gives you more control over your sensor placement. Avoid sensor positioning that invites biting on the cable. When you want a patient to close down, try not to use the word bite. Instead, instruct the patient to slowly close and not to bite on the sensor cable. Having the patient go into a crossbite or moving the sensor cable to the midline can reduce the chances of your patient biting down on your sensor cable. Be sure to take extra care when taking occlusal radiographs. Your sensor is built to last for several years, but there is no point in putting more stress on the cable than is needed. So never tug on your cable to take your barriers off. Always let the barriers slide off or tear the barrier along the seam and take the sensor out that way. To help prevent cross-contamination, the sensor should be disinfected according to the ADA and CDC's recommendations on heat-sensitive equipment. The manufacturer recommends wiping or swabbing your sensor with a non-alcohol disinfectant. Never ever use alcohol-based products to clean your sensor. The sensor plate itself is waterproof, but never ever expose the USB connector to any liquids. Store the sensor on 2 hooks 12 inches apart when the sensor is not in use. This will reduce the chances of creating kinks, twists, or bends in the cable. If your dental staff is new to using digital sensors, protect your investment by providing training for your staff and having a protection plan for your sensors. I hope this video provided you with some useful tips on how to care for your XDR sensor. If you have any questions regarding your sensor, please remember we are only a phone call away and all of us here at XDR are always happy to take your phone call. So from our XDR staff to yours, we thank you.